and practicing since last 1988 in Agra. Today we are talking something about the experiences, notions, and the myths. They all three are the sequelae. The old people have got their own experiences, then they form the notion, and at times those notions becomes myths. And today I'll talk about those myths during pregnancy. And those myths, they are good in the olden days, but in the present scenario, they have got some scientific basis that they should not be done. All the notions which has got their scientific basis, they are good to listen, they are good to follow, but the notions which are without any scientific base, they are the myths. So during pregnancy, the first myth is that we should eat for two. This is a big myth because the baby who is in the womb, who is in the uterus, is not going to eat rotis, dal, and whatever the lady is drinking or eating. The food for the fetus, for the growth and for the development, is being supplied by the umbilical artery, and that is the blood and the oxygen from the mother to the baby through the placenta. And it is whatever the contents are present in the blood is being transmitted to the baby's body through the umbilical arteries. So eat for two is an absolutely wrong notion. Yes, that should be done, that there should not be the quantity food, it should be the quality food. Quality food, like if the lady is pregnant, she should eat good quality balanced diet containing good quantity of protein, less carbohydrate and fat, and good quantity of the minerals along with the good hydration. This is the total saying during the pregnancy, that we should take care of our diet accordingly to the weight, and the as the pregnancy advances, we should improve our diet accordingly as far as the quality is concerned. As far as the diet is concerned, there is again a myth that there should be a good consumption of the fat. And the fat means that the ghee should be given in an abundant quantity. And the scientific basis over that is that if you consume a good quantity of the ghee, then it will facilitate the passage of the fetus at the time of delivery. So this is again a very questionable and a very abnormal belief, or it has got the basis is very wrong, because the facilitation of the baby during the parturition, during the delivery, is absolutely based on the muscles, on the bones, on the joints, and the type of the pelvis what the lady is having, and the presentation what the fetus is coming out, and the glands which are working at the time of the labor, they lubricates the passage, not the ghee that you have consumed during your antenatal period. So consumption of the fat, consumption of the ghee during the antenatal period is not going to serve for the normal delivery, rather it will increase the weight of the lady. And once you have increased you increase the weight more than 10 to 12 kg during the 9 months, it's not going to come to the original position, and the lady is D-shaped after delivery, and then that is a point of depression. So this is absolutely a myth to consume a lot of ghee during the antenatal period. Along with that, there is again a lot of myths that you should not eat this thing and that thing, like papaya. Papaya should not be taken in first trimester, or rather in during pregnancy, because it acts as a abortifacient. Though it has got no scientific basis exactly, because papaya is very good for the digestion, and it is a very good source of vitamin A, and it never acts as a abortifacient. So these are the myths which should not be followed at the present scenario. Another myth is the stretch marks. The stretch marks are supposed because of the itching, and they are the marks of your nails, which you are itching on your abdomen. But exactly it is not. The stretch marks is because of the increased threshold of a skin to get stretched. Means when your baby bump is getting more, the abdominal girth is being more, your skin is getting stretched, and there is a threshold of a skin to get stretched, and after the threshold is crossed, then the lower level of the skin that gets torn, and these are the marks, these stretch marks are exactly the marks of the tearing of the lower level of the skin. And it is not only in the pregnancy, but if the lady or anyone, any individual who has gained weight excessively within a very short period of time, so you can see those stretch marks on those bodies also. And the common sites is the abdomen, the thigh, the upper arm, and it may be on the hips. So it is not only the antenatal period, or it is not during the pregnancy, but anywhere if there is an sudden increase of the fat in the body. So if the lady is having itching at the time of pregnancy, so she should apply a good moisturization and do the circular motion so that you can increase the stretchability of the skin. And those stretch marks, they are certainly, they will come, it's a natural process, and it will not go even after delivery because it is a tear skin. It cannot be restitched, it can go only by the cosmetic surgery. But if the lady is having a taut skin and it is not moisturized properly, so they will appear before 4 or 5 months. But if you are moisturizing your skin very well in the circular motion, so it will come a little bit late and it will be a little bit less. So these are not the marks of your itching, these are not the marks of your nails. The another thing is, the lady used to ask, okay, what is the role of the rest, what is the role of the exercise, and can we climb the stairs, can we go with the, can we lift the weight? So again, there is a myth. Some people, they used to say that when once your pregnancy test is positive, you go to the breast. But it is not like this, because the rest does not help you anything. If the baby is of bad quality, if the baby is congenitally abnormal, and if the development is not proper, the abortion will occur if you are taking the rest. But if you are working, it doesn't mean that because of your work the baby is not in a good shape, the baby is weak, or the abortion is there. This is not true. So the working is, like we used to suggest to the pregnant lady, that if you are a housewife, so you can perform your household activities in the same way as you were doing before in a non-pregnant state, but there should be a balance of your work and your rest. Like, you should not tax anything on your body. If your body is tired, you should take a little bit rest, and after some rest again you can start your work. So there should be a balance in between the work and the exercise. And as far as the working pregnant ladies are concerned, so the working condition should be the same, and that depends on your body. Whatever you feel like. If you feel tired doing your work at working place, so stop working. But if you don't feel, if you feel good working at your working place, so you can continue your work till you feel tired, until you feel uncomfortable, then you should stop the work. And we always advise to a working lady to work till you are unable to bear that work. And what as far as the climbing stairs are concerned, The climbing stairs is not absolutely prohibited, but it is prohibited that you should not walk very fast. You should not climb the stairs with a heavy load. So it is your body, whatever your threshold, whatever is your work you can do. So you should do that kind of work that your body should not be taxed. The females who are listening this talk can ask the question by giving the messages. I will give them as I will answer the your questions along with the whatever I'm saying, and I will continue my talk. Many of the ladies, they feel like that can they drive during the pregnancy? Yes, they can drive the four-wheelers, but they should avoid the havoc driving. Means there should be a comfortable drive. There should not be no panic in the driving. But the two-wheelers, we should do the two-wheeler driving whenever it is utmost important. Otherwise, we should avoid it. The air travel is again allowed. You can do the air travel if it is not more than 2 to 3 hours. There is one question along with my talk. Priyanka Tiwari. She's 7 weeks, 6 days pregnancy, and she's having some stone. She's having some stone of 3 mm. But she has not mentioned that this stone is in the gallbladder or it is in the kidney. Whatever the site is, if the stone is there, then it is not a problem, because this is not a problem. It is a problem if it creates the pain. When there is a colic, then it's a problem, because we can't give very much painkillers to the pregnant lady. Only then it is only then it is panicky, otherwise it is not. There is Abhi Joy. उनका क्वेश्चन है that 20 weeks pregnancy, second ultrasound कब कराएं? The role of the ultrasound in the during the pregnancy period is that the first ultrasound should be done as soon as you reach to the doctor on the first visit, and the second ultrasound should be done at about 13 to 14 weeks. That is called anti-NB scan, in which we see the nasal bone and the nuchal translucency, and it is a pre-indicator of lot many congenital anomalies. Then the third ultrasound should be done at about 18 to 20 weeks. That is the level 2 ultrasound, that is also called the anomaly scan. That is a detailed ultrasound which shows the different organs of the fetus. Again, it is very important for the development of the baby. And then third ultrasound should be done at 7 to 7.5 months. And after that, that depends whether your baby is growing well or not. If there is some problem, if there is some growth retardation, or there is some less movement of the fetus, then we can go accordingly the rest of the ultrasounds. Krishna Sane is asking, many people keep asking about the rules to follow during eclipse. Does it really affect? Yes, very good question. Eclipse, in fact, has got some rays, but those rays are not always in all the eclipse. But if it is a solar eclipse, the lady should avoid to go out, because you never know what kind of rays you are suffering from, on what angle they are coming on your abdomen. So if there is eclipse, better to keep at home until unless it is required so much. Namita Peter, she's asking, stomach burning, especially in midnight. Stomach burning, I think she's having some gastritis, she's having some acidity. The acidity is very common during pregnancy because the digestion, the intestinal flow or the peristalsis of the intestine gets slowed down, and moreover because of the increasing weight of the baby, there is a pressure on the stomach, so the regurg is there. In the midnight is because in the midnight the flow of the acid is too much. So for that, you should take a good amount of the pillows and your head end should be raised. You should take good amount of water and avoid the spicy and the fat containing diet. So you can get rid of this problem. Harsha is asking that she's 17th week pregnant and she got fever yesterday and experiencing white discharge. It's Sunday today. I have appointment on Monday. Should we go to the emergency? Okay. She's worried about the white discharge. So it is very important to know about the discharge, that the discharge actually if it is sticky, if it is white transparent, so it is good for your health because this discharge helps to remove the infection from inside to outside. This is a medium, or this is a protection rather, that it will not, the infection will not ascend from outside to inside. But if it is a watery consistency and it is continuously leaking, it means there is rupture of the membrane and you should immediately consult to your doctor, whether it is an emergency, whether it is night or it is Sunday. You should not see any of the day, any of the time. So if it is watery and continuous leaking, then you should immediately go to the doctor. And if it is sticky and it is small, it is not wetting your undergarments, then you feel like that it is a natural protective phenomenon. So I was talking about the myths during pregnancy, and the myths during pregnancy is again another myth. I'll let you know that the people used to say that you should always lie down left lateral position. It's not like good, but if you are, the lady is uncomfortable in left lateral position, then if the lady is uncomfortable, then the baby will be uncomfortable, so there is no sense to lie down in the left lateral position. So I used to advise to the pregnant lady that she should lie down in that posture in which she is comfortable. So your comfort is the baby's comfort. You should not feel like that the whatever written in the books, whatever has been written in the guidelines should be followed exactly, because if you are lying down left lateral position and you are not able to take a good sleep, again your disturbed sleep will hamper the development of the baby. So this should not be like this, and you should lie down whatever is comfortable for you. The second thing is very important about the exercise during the pregnancy. Some people used to say that the exercise during pregnancy that helps in the delivery of the baby. We want a normal delivery, and whatever we'll do the exercise, we will be able to do the normal delivery, and that will be painless. Not like this, because the exercise which you are doing, you don't know exactly. It is good to follow the antenatal exercises, but all the exercises should be under the supervision of some trainer. It should not be like this, that you have seen the videos, if you have seen the CD and you are following that. Because any of the exercise, if your muscles is pulled off, then you will be nowhere. Yeah, you have to take bed rest and you will be in a painful situation. You have to take lot many medicines, and rather to go for a normal delivery, and to pass on the total antenatal period will be very difficult for a female. So The good brisk walk and homely all the activities is a very good exercise. And if you want to do some exercise, you should do under the supervision of some trainer. There are some females who used to say that I am having a breech position, and if the breech position is there, tell me something about to eat, tell me something about to exercise, so that my baby will be will get a normal, yani ki it will become a cephalic position. It's not like this, because the position of the baby depends of so many things. On all those factors, they are not under your control, because the size of the uterus, the size of the baby, the shape of the baby, shape of your pelvis, that all depends on that all governs the position of the baby. So no exercise, no medicine is going to change the lie of the baby. If the baby is breech at about 36 to 37 weeks, means 8.5 month pregnancy, it is coming to the normal position or the cephalic position is a little bit difficult. So you should be very closely vigilant, and you should be under the guidance of your clinician, so that she or he may give you the good advice about the mode of the delivery. Poonam Sharma is asking that she is 11 weeks pregnant and she is continuously losing weight. Poonam, it is a very good question, because I have seen in first trimester there is nausea, vomiting, loss of appetite, ghabrahat, and there is a lot of perversion of the taste, and at times there is excessive vomitings also. So that causes not increasing the weight, rather the losing of the weight. So in the first trimester, if the excessive vomiting and loss of appetite is there, you may lose weight. So don't lose your heart if you are losing your weight in first trimester, because as soon as your hormones level will be settled down after first trimester, you will be able to eat properly, and then you will start gaining weight. As far as the weight gain is concerned during pregnancy, the 9-month tenure causes only 10 to 12 weeks to 10 to 12 kg weight gain during the 9 months. So if you are losing weight at 11 weeks, no problem. Karthik JV, she's 41 years old. She's having 3-month pregnancy, and she's having her third pregnancy. She had some spotting is there, and she has been given some injections at 8 weeks, and she's worried about it. So, Karthik, you should not be worried about it, because you are taking good injections. That is the support of the baby for the development and to retain inside. And you go on visiting your doctor very closely and every fortnightly. If the spotting increases, you should again go for ultrasound to be done in a very short period of time. You should not be worried about that how much ultrasound I should go for. If you are being asked to go for ultrasound every fortnightly, no issues, and take all the supports, and you should not be worried, because worry is again a very big cause of the abortion, because your worry is work on the hypothalamus, and this is the part where the lot many hormones are being secreted. And if you are happy, then happy hormones. If you are sad, if you are worried, then the worried hormones will be there, and that may affect your baby. So be happy and feel that this is not a disease. This is a very good journey to the motherhood. And if it is a good mother, if you pass this journey in a happy gesture, in a good gesture, and very accepting gesture, then the outcome will be too good. Time is very short and my myths are too many. So again, I will come in front of you to tell the rest of the myths. There are again lot many myths. Before I finish my talk, a very short myth I would like to share with you. There is old woman's tale, and the old woman's tale are lot many. The old ladies, they used to predict the sex of the baby, whether she's having a male baby or whether she's having the female baby. So if your line of the linea negra, this is a short, then it is a baby boy, and it is long, it's a baby girl. If the lady is pressing over the left leg more, then it will be a baby boy. If it is on the right, then the baby girl. And if she's having excessive vomiting, then it is a baby girl. If the lady is looking very beautiful, then the baby girl is there. So there are a lot many myths and there are a lot many old women's tale. But I should say, in the end, I would like to say, don't go in the myths, don't go for the old woman's tale. Pass your journey of the motherhood in a happy way. Whether it is a male, whether it is a female, it is your own child, it is your own blood, it is the part of your body which is coming out after 9 months, and it should be as loving as the part of the body is. And the myths, if you having some myths, don't go for the myths, consult your doctor. If your doctor is giving some scientific basis for the myth, then it is okay. Otherwise, don't go to follow those myths. If your elders are saying something, don't disregard them, but take some midway in between them, so that your elders, they must not feel like neglected, and even you feel that your myth is not scientifically based, it is baseless, so you go accordingly. But don't disregard to your elders, because they are having very long experience, and after that experience they have come with this. Thank you for today. Namaskar.